necessarily MDs are doing this specific treatment nowadays. I've been doing this for over 12 years, and before it was unheard of for anyone else in the medical industry to do this treatment. This is called PDO threading. Right here I have the Miraku threads. These are the strongest, most highest tensile strength threads in the United States. Very unique. You can actually see the cannula goes all the way down. A cannula is a non-sharp insertion tube that has our thread inside, and you see this little cap. This cap allows these threads to be the most meticulous and strongest of anyone that's on the market. And the reason I bring up doing this filming for the nurses is because so many nurses are now getting to aesthetics without a lot of proper training. So it's really important when you do start to do these treatments, you watch videos from someone like me, or you go to conferences and you learn it from the proper places and techniques, because it's very important to be really good at what you do. I don't care what your education is, I just want you to give the best service. So we have my client here that wants to look super sculpted. He's a really good looking guy that just wants something for rejuvenation.
Can we accept a request from someone?
We need him looking sexy and fresh.
Can we accept a request from someone at Benev to join the live?
Sure, I don't mind. And so we're gonna do that with PDO threads. And you guys see I've marked out my vectors. I'm gonna insert one and I'll explain them. One of the things very few people do is they zone off the vectors in men. Now with him specifically, who do we have on? Who do we have on?
Noel joined us.
Noel, what's going on?
Didn't expect I was gonna go on live.
Oh,
I saw the request. I saw the request.
I thought I was.
Well, you didn't have to. I wanted to say hi. I wanted you to say hi because we have a lot of nurses and ancillary providers that are going to be following this, and I'm showing them that it's very important to have proper education, having very informative training, and being able to learn from the best when it comes to these threads, because this is like driving a Ferrari. That's what I tell people. You can drive any car, but driving a Ferrari is difficult, right? So if you're going to have the best thread in your hands, you really have to know how to use it. And so
we appreciate the trust that you put on our threads.
Thank you. And the results are what show it the most. And this past weekend when I taught, I showed results that we have lasting over a year with even one single treatment, building collagen, giving that contour, improving the overall facial sculpting that we're looking to achieve, right? Is that what you would say?
Yes, indeed.
So he is excited to do this. And what I want to show was I'm doing what I call a mixed vector, okay? We're crossing over the zones. And sometimes when you do that, that allows more sculpting. So in his face, he already has like a very defined jawline. He has a high cheekbone. We want that central area to look model-esque. How do we do that? The slimming effect, the sculpting effect, without using a filler? We cross the zones. So we're gonna take this thread, this last one.
Noel, let me know if you want to stay on or not. Let me know.
And we're gonna cross that zone.
For him. I'll exit.
Well, we love you. By the way, we love you.
We trust him.
Great to see
Yes,
you.
we love you.
So I'm gonna cross that zone and look at what you can achieve, okay? I'm gonna show you guys, look.
Oh yeah.
Okay, down here, we're getting improvement in the tissue being fixated in an entire new location and defining him out instantly. So this is what we call a trivector, and you guys can see it allows us to get improvement in the entire mid and lower face in one location, out of one insertion point. So, and I always tell people, you're gonna need a little bit of, not necessarily puckering, but we need to see something. So that's what we're gonna do.
Yeah, I can't even feel it that much.
Yeah, that's the thing. So isn't it true that the initial part
You can just feel
with the
pressure.
numbing is what's the crazy part?
Feels like the joke I used to do as a kid. I'm like,
Yeah,
inside.
No, it's true. All right, stay all the way to the right. Perfect. Turn a little bit more your head to the right. The right.
Oh, the right,
There you
right,
go.
right. Okay.
Beautiful. Beautiful. So now we're gonna work on the lower face. Now this is a longer thread. You guys see 100 millimeters, much longer. But this, regardless of length, this still has a lot of strength. And it's gonna allow me to, again, build collagen in a deeper area where people tend to notice looseness, and that is the jowl area around the mouth. Last one for
People
lower
are
face.
saying BBL did not work to shrink my pores. Come see us, guys. Make a consultation. Send us a DM. Full name, email, phone number. We have several treatments to shrink your pores and skincare products.
the other thing I want you guys to see is the 360 molding of these threads. Take a look. Again, these are heatless molding. And remember I was telling you before, some threads are laser cut. When they cut into the thread, they actually decrease the tensile strength. But by molding, you increase the tensile strength, allowing much more security, even 360 degrees, and they have bidirectional cogs here that will allow much more improvement in global collagen production. The one thing you gotta worry about with guys is not getting hair into the entrance site.
Love that one.
'Cause you don't want any infections or any hair follicles to get like a little pimple. Now the last part is the neck. Now here's the thing, you can go above or below platysma. On the neck there's not a lot of fat, so I kind of want to, I always go back here and I grab platysma. We're going right by that muscle. That muscle is the sheep muscle in the lower face and neck that gives the neck its contour. And in someone younger, where you want a little more tightening, or we want a little more contouring, we need to go a little deeper. Okay, but this allows us to do that. So look, you can secure this tissue right where I want it. Right here is the edge of the angle of the mandible. I'm gonna secure right there. Okay,
I can feel
so
it.
you can see it. Yep, exactly, and you can
feel
see
this.
it. So it's important. Part of this is just the technique aspect. It's not just putting it in and pulling it out. We got to actually work for it. You take that however you want to take it. Okay. So and then this one, different
take it.
angle. You already are. Don't worry. You just got a long thread inserted in your neck. Longest on the market. Longest and hardest on the market. Kidding. So you guys see now, look, I'm gonna show you what we did. We just secured this tissue now right at that angle and really, really sculpted out the jaw. So he's going to get a super contoured look and a lot more collagen production. And you guys could see, again, the cogs on here, super strong. This neck isn't going anywhere. So sometimes you can do more than 2 threads. He doesn't need it. We're doing the largest, stronger ones there. Now we have our final result. So I want you to look just straight up for a
The
second.
longest and strongest on the market.
Yes.
Oh, okay.
So Jordan, let me clean them off. Why don't you pan for a second? I'll also lift him up. And we'll show everybody. Initially, it's going to look more swollen. He's gonna look a little bigger. The positioning of his cheek fat pad has now been moved up into a new point. So he's gonna look a little bit chipmunkier today, and he's gonna look a little pinched at the lower portion. But what that's gonna do in the next 1 to 2 weeks, as it settles, that Model-esque look is really gonna come in. Collagen's gonna build. If he had some scars in his mid-face, they would actually improve because we subsized through them. And then look at that jaw. I just want you guys to look, show that jaw, 90 degrees. Yeah. Unbelievable. Runway
Dr.
ready.
Emmer.
Runway ready.
What are we
Yes.
doing on October 23rd if someone wants to learn more?
Wait, say that again?
What are we doing on October 23rd if someone wants to
We are
learn
going
more?
to be doing an exclusive webinar, you guys, on these threads, my techniques, sculpting techniques, and how to address both male and female faces. I want you guys to join, check out my Instagram, follow with Miraku, and you guys will learn how we can talk about these amazing transformations you can create with just doing PDO threads. So let's bring him up, and you guys can see, keep your head back a little bit because I want them to see the jawline. And then we'll keep you right there, and they'll do just a little pan, and that's it. How was the pain or anything?
Just pressure.
Good.
The lidocaine really did it good. I was like, man, it's funny. I feel like I'm talking like a robot, but I
I
understand
know.
the swelling.
That's good. But the great thing is you guys can see already, even with the swelling, it still looks significantly better. And all of this is really gonna come in the next really 3 to 6 months, but we'll notice in the next few weeks. So stay tuned for more, you guys. We'll follow updates. Tell them again where to find you.
Oh yeah, simplenursing.com on YouTube, Instagram, or any social media.
Yep, and you guys will see transformation over the next few weeks. Bye, guys.
Yeah, maybe it's
Well, he said
maybe
like
it's
once.
like